Eric Hammer here, registered physiotherapist. Today, I'd like to talk to you a little bit about the importance of knowing the aggravating activities and the easing activities of a particular injury. Essentially continuing on with my series on advice for other physiotherapists. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So I wanted to talk a little bit about the importance of really taking time and really trying to discover what positions, movements, activities makes a patient's symptoms worse, right? And I think this is one of the most important things in terms of really creating a clear picture in a subjective history of a patient in order to really understand what structures, what areas might be involved in terms of pain. And so a really great example of that would be along the lines of somebody who's had, let's say, a disc irritation in the lower back, where in a lot of cases what we'll find is there'll be a pattern, right, in terms of the aggravating activities that might be provoking symptoms. So in a lot of cases, perhaps it might be flexion-based movements, right? Sitting, bending forward, putting on shoes, prolonged driving, these type of things, right? Where it's more of a flexion-based movement in the lower back that's creating pain. And then in a lot of cases, right, the opposite of that might actually be causing some relief, right? So the patient might say, hey, when I'm standing, when I'm walking, when I'm going into more positions of extension. So these, gathering this information can really be helpful in terms of, number one, what we might be looking at in terms of an objective, right? So our objective exams, what areas we might be thinking is involved even prior to, going through movements with the patient. And then also with a specific treatment plan, right? So going back to the lower back disc example, right? So in a lot of cases, I might be biasing an extension-based protocol, right, for a patient who's presenting this way, and really gathering this information in the subjective history can go a long way in terms of, number one, how we're assessing, and then number two, our treatment plan. Thanks again for watching, and if you have any questions, concerns, feel free to leave a comment below, and please make sure to check with a physiotherapist or a doctor to make sure this or any other information is appropriate for you. Thanks again and have a great day. Take care.